temperature. Next, which of the following manifestations are evident in a client with superior vena cava syndrome? So what is your superior vena cava for? So your SVC is, what do you call this? This one is, it carries oxygen for blood to the right atrium. It brings back the unoxygenated blood to the right atrium. So what if there is a superior vena cava syndrome? Will there be facial swelling? When you say superior vena cava syndrome, there is blockage of the superior vena cava. What will happen? Number one is yes, there would be facial swelling because the blood cannot go back to the right atrium. It will be stuck on the upper or the head. So facial swelling. Number two, periorbital edema is yes. Number three, edema of the neck or your stroke sign is also a yes. Okay, again, superior vena cava syndrome, there would be blockage of the superior vena cava. So there would be, what do you call this? So the fluid or the blood will not go from the head towards the brain. Number four, edema of the arms. Edema of the arms? No, because the most likely your superior vena cava, again, head, not the arms. And number five, nose bleeding. I'm so sorry, edema of the arms. It's a yes, I'm sorry. Yes. What? Edema of the arms. I would have to check your number 4. I will have to check your number 4. But for now, it's undetermined. Number 5, nose bleeding. Can there be nose bleeding? Oh, question. If the blood doesn't go from the head to the heart, will there be an increased pressure in the head? Yes or no? Yes. And if there is an increased pressure in the head, can that cause rupture of the small veins, small arteries in the nose? Yes or no? Yes. Therefore, will nosebleed occur? Yes. Okay. Yes for that one. So I will have to check your number 4 before I say yes for this one. Now, after suffering an acute myocardial infarction, a client with a history of type 1 diabetes is prescribed metoprolol, IV. Which nursing interventions are associated with IV metoprolol administration? Select all that apply. Number 1, monitor glucose levels closely, yes or no? Is yes. Okay, because your metoprolol can actually mask the signs of your hypoglycemia. So you have to monitor it to make sure that your patient doesn't go below level of their sugar. Number 2, monitor for heart block and bradycardia, yes or no? Is yes. Okay, because your metoprolol, of course, could cause, actually, it's contraindicated for your clients whose heart rate is below 45 beats per minute because it can decrease your BP. It can also cause your bradycardia. So if your patient has heart block and bradycardia, you never give this one. Number 3, monitor blood pressure closely. Yes, because it can decrease your BP. Number 4, mix the drug in 50 ml of dextrose 5% in water and infuse over 30 minutes. Should you mix metoprolol? Do you typically mix metoprolol? No, usually you would just give it through your Y-site connection. Nothing, no need for you to mix it with your D5. Number 5, know that the drug is incompatible with morphine. Is it not compatible with morphine? Actually, it's okay. Okay, your metoprolol is compatible when mixed with even with your meperidine or your morphine sulfate. So number 5 is false. Okay, last two questions. A client has a potassium level of 2.2 mg per liter. Which doctor's order should the nurse question? Okay, number 1, mannitol. Yes or no? You have a list of your diuretics here somehow. So with your diuretic, you have your potassium sparing and your potassium wasting. Is your mannitol potassium wasting? Yes or no? Is your mannitol potassium wasting? Yes, and if your patient has a potassium level of 2.2, which is below normal level, do you give mannitol? Of course not. So we should question this one. Your aldactone, is it potassium sparing or potassium wasting? Aldactone, it's a potassium sparing drug. So do you question this one? No, also because it can maintain your it doesn't change your potassium level. Number 3, Lasix, your furosemide. Is that a potassium wasting, potassium sparing? We all know this one. It's potassium wasting. So do we question this one? Yes. Next, your triamterene. Oh, is your triamterene potassium wasting, potassium sparing? Potassium sparing. So do we question this one? No. Okay, so your Colace, your docusate sodium. This one is not a diuretic but rather a laxative. Do you question this one? Yes, because with your laxatives, potassium can go out with your loose stool. So yes for this. Last question for today. A 7-year-old is admitted to the hospital for a course of antibiotics. What should the nurse do before inserting the peripheral IV catheter? Number 1, explain the procedure to the child immediately before the procedure. Yes or no? Do we do it immediately before the procedure? Actually, guys, no. Okay, we do not explain the procedure immediately. We should take time. Okay, we should take time in explaining it to them, because when you say immediately before the procedure, there is no time for them to take in your health teachings or explanation of the procedure. They cannot ask questions. So you say it, or you explain the procedure, your IV catheter, so that they are able to somehow compose themselves also. Number 2, apply a topical anesthetic to the IV site before the procedure, yes or no? Can we apply topical anesthetics? Actually, yes. We can put some lidocaine on the area so that it would not hurt as much. But usually we give this one before 1 hour before the procedure or your IV. Number 3, ask the child which hand he uses for drawing. Yes, so that we can use the non-dominant hand. So he can still, draw, write, color, play with their dominant hand. Number 4, explain the procedure to the child using abstract terms. Yes or no? No, of course not, because they will not listen to you. Only use children's language. Okay, number 5, don't let the child see the equipment to be used in the procedure. Yes or no? No. They what do you call this? If they have the sense of what the equipment is, they most likely will let you do it to them. Number 6, tell the child that the procedure won't hurt. No, you have to be honest with them. Surely, IV insertion is painful. You also do not tell them it's just like a bite of an ant. Okay? Because we don't know for them if it's painful, or we don't know if for them for them the ant bite is not painful, but the IV will be. they will not trust you anymore next time. Correct, false reassuring. And remember, it differentiates painful feelings differentiates for different people. So you most likely would want to tell them, they say that it is painful. You can say that other people says it's painful, but it's different for each person. So for me, you can share your experience. For me, I had IV insertion also. It is painful, but just a few moments and then it will be gone. Okay, so at least you are honest towards the procedure. Okay? So, NCLEX students, my dear colleagues, please never give up on your NCLEX, on your dreams, because it will be worth it in the end. I know that you are great nurses already, and you are going to be great USRNs. Just keep going. Do not stop.